Again, I think it's a commonly held misconception, a myth, that this decision-making is fraught, difficult, complicated, stressful. Usually, it's none of those things. Why? Because families come together, usually, when somebody is dying. They come together as a family, so that the people that you're meeting there are there for a reason. They're there to support the person and to support each other. And they bring that kind of an attitude to this discussion. They tend to be very open to discussion. Remember, this discussion is by no means the first time there's been a family discussion about some pretty dreadful things. You don't come to intensive care for a haircut. You've come there because your life is in danger. And the family will have had a meeting about that. And then when it's clearer that the person is probably dying, there will likely have been another meeting about that. So the family are all known to each other, they're known to the staff, vice versa. There's already a relationship. And there's already an atmosphere where we're all working together cooperatively to address the needs of the person, the patient, now the dying patient or the dead patient, and the family. And the family have that kind of collaborative, cooperative relationship with the staff and with each other. And although people have individual views, it's not the individual that's making a decision here. It's the family as a family. And sometimes that means that some people in the family want to participate strongly in this discussion and others don't. They say, you know, I'm here to support so-and-so, and whatever decision so-and-so makes, that's fine. The atmosphere is usually one of calm and of compassionate, rational sort of interaction between the staff and the family and between each other. And people don't tend to agonize over the decision. They discuss it, and what decision they make arises fairly naturally and usually fairly quickly. They've already had to deal with something, I think, much more momentous, that is the death of their family member. Compared to organ donation, that's a much bigger deal. They often will have had to confront the issue of, should treatment be limited or withdrawn? Or should we continue to treat the person in the hope that they might recover? People think, if I've put donor on my license, then I'm going to be a donor. That's it. Don't have to do anything else. Well, very few people actually die in circumstances where donation is possible. It's less than 0.5% of all deaths take place in a circumstance where organ donation is possible. A lot more people could donate tissues, such as eyes and skin and heart valves, but organs, very few people can donate. So lots of people confront the driver's license question, but less than 0.5% of them are ever going to be in a circumstance where they could truly donate. And then, regardless of what they've put on their license, if they are dying in a circumstance where donation might be possible, somebody will talk about that with their family. Now, when that occurs, it's very rare, in fact, for the families to request that information. Commonly, they don't know what that information is. They know the person, and they may think they know what's on the license, and maybe they do, but it's not often even that it's been discussed by the person. And sometimes when they say, we'd actually like you to find out, and we can find out what is on the license, they don't get the response that they expect or the response that they would want.